Well, Sean, it's one of those things we inevitably can look forward to. Cataracts at some point affect almost everybody. And this month, June, is actually Cataract Awareness Month. There's so many questions about the topic. I know my mom recently had cataract surgery, so I've learned a little bit about it. Would you like to learn a little
I
bit
would
more about it?
I would like to learn as well. Dr. Raymond Theodosis, he is here with Shepherd Eye Center to help explain what the heck these cataracts are and what we can do if we find ourselves the lucky recipient of being one of them. Hi, how are you, buddy?
Doing really well. Thanks. Thanks for asking.
It's great to have you. So explain what cataracts exactly are. What are the symptoms of a cataract?
So a cataract is simply put, the lens we're all born with getting cloudy over time. And the symptoms of cataracts can vary. The most common symptom will be just a decrease in vision, feeling like your glasses prescription isn't correct, or if you don't wear glasses, that you're starting to need some glasses. Other symptoms can include glare at night from headlights of cars or bright lights if they're shining in at you, needing more light to read, feeling like colors are a little washed out, not seeing the whites as quite white, having a little yellow hue to them.
Yeah.
Basically just difficulty with the vision that you are used to having, not performing like you'd like.
Yeah, certainly. And doctor, glasses can be something people like myself put off. With cataracts and the symptoms you just described, these are things that sometimes you can live with for quite a long time. At what age do these commonly appear? And at what point in those symptoms should we really come in and see a doctor?
I think the safe answer to the last part of that question, and I'll touch it first because it's the most important, is if you notice a change in your vision or the way your eyes are functioning, the best answer is to always come in. Like you said, most of the time you're not delving into surgery. Most of the time the answer is a little bit of glasses, or your eyes are dry, or something else that can be taken care of relatively easily. But the worst thing is not knowing what's happening and living in fear, or maybe living with something that's causing damage that needs to be addressed sooner. As far as the age with which cataracts typically occur or become significant, it's probably around 70, 75 years old. But at the same time, I've done cataract surgery on people that are in their 40s as well as
Wow.
people at
Oh,
100.
wow.
So it varies widely.
Right now, Sean, we're going to hear from an actual client. Her name is Caroline.
Actually, the surgery did a great deal for me. I am a knitter and a beater, and after the surgery, I could thread my beading needle without any problems. I can drive at night, no hassle. I did not have to wear glasses after the surgery. I have the multifocal lens, which corrects both the distance and close up. I had a wonderful experience at Shepherd Eye Center. They are very professional and top-notch. So if you have a cataract, do not hesitate to go there. They will take care of you. Just get yourself in there and they'll do the rest.
All right, so let's talk about ways then to prevent cataracts. What can we do to
Hmm.
not get one of these, or how can we treat one if we do get it?
Yeah, so prevention of cataracts, I usually tell people it's the same thing that all your other doctors tell you. Don't smoke. If you have diabetes, control your blood sugar as best you can. Stay healthy. There are a few specific things that are specific to eyes themselves. One of those is wearing sunglasses if you're going to be outside in the sun for
Mhm.
extended periods of time. But taking a multivitamin, being as healthy as you can. Now, the treatment of cataracts, unfortunately, at this point is a surgical treatment. There's no eye drop yet that exists that gets rid of cataracts, and it's as surgeries go, which is a big caveat. It's a good surgery. It takes only about 10 minutes to perform. Recovery is pretty easy. It's the best surgery there is.
That's right. And it's come a long way, I understand, doctor. I've learned a little bit about it recently. Like I mentioned in the beginning, my mother, just about 6 weeks ago, she had one eye done, and then I think she waited 2 weeks and had the other eye done. Is that common, by the way, in separating the surgeries?
Yeah, and that gets to some of the point that we end up talking to patients about is it's a no matter how slick it sounds and how awesome your neighbors make it sound and how good a surgery it really is, the optimal word here is that it's a surgery, and so we take as little risk with both eyes at the same time as possible. So one eye and then the other, in an effort to try and minimize risk to you.
No question. Before we go, let's talk about Shepherd Eye Center. You are now welcoming all in, including elective surgeries right now during this, not post COVID-19, but midst COVID-19 situation. How have things changed for you?
Yeah, I think as far as the care of patients, we're sort of normal in the way I interact with them. Things that have changed are everybody's wearing masks, as you might expect, where everybody's 6 feet apart throughout the whole process. Every surface in every room is wiped down between every patient. So we're going through a lot of chemicals. But as far as the care of our patients and the interaction between the doctor and the patient, that hasn't changed and shouldn't change.
Fantastic.
And that's good to hear because, well, if you're struggling with something like this, Sean, you don't want to put it off because it can be, it's unnerving and worst case, it's dangerous as well. Doctor, how long have you been with Shepherd Eye?
Going on 7 years. So been here a little time, not the 30 years that Shepherd Eye has been around, but been here a little while.
Absolutely. Well, it's great work that you do, and we appreciate having you so much. Dr. Theodosis, thank you so much.
Thank you.
It's my pleasure. Thank you, guys.
All right, if you want to learn more about Shepherd Eye, you can just go to shepherdeye.com. Their number also right there on your screen. Shepherd Eye Center, a proud sponsor of the Morning Blend.